So hello guys, welcome to my YouTube channel. My name is Maria Moses, and I'm a public health practitioner. I work to support change so that people around me and people around the world can have certain knowledge to make profound choices and take control of their general healthy lifestyle, including their sexual lifestyle as well. Yes, this is in the support of the global effort to end AIDS and HIV/AIDS disease and pandemic worldwide. If you are looking for the latest on testing, you want to access care and treatment, or perhaps you want to get some certain advices on how to go about your marital choices. Maybe your partner is positive and you are negative, so you don't know how to go about it. You are in the right channel. And if you are concerned about conceiving a baby, being HIV positive, someone or person living with HIV, and it is very simple, and you're in the right channel, so you can just drop your message on my email and I'm gonna respond to you. Okay, so today guys, if you love my video, kindly give me a thumbs up and kindly subscribe to my YouTube channel, and don't forget to hit the notification bell so that you'll be the first person to get notified when we release a new updated video. So today we have a very important topic to discuss. Like, I have very important news for you, or something to talk about. Today we'll be talking about pregnancy and HIV. When should I get tested? Well, this is amazing. If you have been following from my previous video, I've talked about what HIV and AIDS is, and I also talked about signs and symptoms of HIV and AIDS, both in male and female. Then I've talked about signs and symptoms of HIV, particularly in women, and the likes of them. So you can refer back to my previous videos on HIV and AIDS, and you will also know how so far you're going to derive certain knowledge on what we are going to be talking about. But today, like I said, we'll be talking about pregnancy and HIV. When should I get tested? Well, before then, I'm going to be talking about certain facts about HIV and AIDS. Okay, as regards the pregnant woman. Now, a pregnant woman living with HIV, okay, can pass the virus to a baby during pregnancy, okay, during childbirth, and through breastfeeding. 2, if you are a woman living with HIV, okay, taking antiretroviral treatment correctly during pregnancy and breastfeeding can virtually eliminate the risk of passing on the virus to your baby. Okay. 3, attending antenatal appointments means that you can get tested for HIV, and if needed, you receive a treatment and medical advice. This will help you to keep your baby and you yourself very healthy. Okay, so risk of passing HIV to babies is very with treatment is 1/100, and then with no treatment is about 25 babies can get contacted. So an HIV pregnant woman can transmit HIV to her baby, like I said, through different ways. We have pregnancy, through vaginal birth, and then through breastfeeding. So let's carry on, friends. And then also, like I said, how is this HIV transmitted? Okay, of course, if you're a pregnant woman, there are numerous ways, like I've said, because HIV also is in your breast milk. So HIV in your blood could be passed to your baby's body through the blood, and this is mostly likely to happen in the last few weeks of pregnancy, and also during labor, or even during delivery. So breastfeeding your baby can also transmit HIV, because the breast milk also contains the HIV. So there is a 15 to 45 100% chances anyways of passing HIV onto your baby if neither of you take HIV treatment. Okay, so however, taking the correct treatment during your pregnancy and while you breastfeed can virtually eliminate this risk we are talking about. All right, so like I said, if you are pregnant, it is very important for you to attend antenatal appointments, as these are the times when you can get HIV test done. So your healthcare professional or provider will definitely offer you a test at your first appointment, and if the result is positive, you will be encouraged to start antiretroviral treatment as soon as possible, and you will also be offered a test in your third trimester, that is from 28 weeks. And remember that whether you are pregnant or not, if you do not have HIV, you may not show any symptoms. So the only way you are going to know whether you are HIV positive or not is to get tested. So if at any point during the testing or during the pregnancy or breastfeeding stage you think you have been exposed to HIV, you may be able to take post-exposure prophylaxis, which we call the PEP. Now, you need to take PEP within 72 hours of possible exposures to prevent HIV from establishing in your body and being passed on to your baby. So if you are breastfeeding, you should discuss whether or not to continue breastfeeding with your healthcare professional. Okay, once you discover that you have been exposed to HIV. So if you are pregnant, it is important to attend your antenatal appointment, as this is the only way you can get to know whether you're HIV positive or not. Okay, all right, so that's that about that. Then how does HIV affect pregnancy? I've said it, during pregnancy HIV can pass through the placenta, okay, and then infect the fetus. And then also during labor and delivery, the baby may be exposed to the virus from that woman, and other fluid as well. So through the blood, perhaps through the blood and other fluid. So when a woman goes into labor, okay, there's what we call the amniotic fluid. That's the fluid in which the baby is able to swim in the womb. It tends to break, and then water breaks out. So once this occurs, the risk of transmitting HIV to the baby is very, very high. All right, so these are the possible means whereby a woman can transmit HIV to her baby. All right, so and then can you give birth naturally if you are HIV positive? Oh yes, you can give birth naturally. Okay, however, a diagnosis of HIV does not mean you can't have children. It doesn't mean that. So but you can pass this HIV to your unborn baby during pregnancy and while during labor and also during breastfeeding. So but the good news is that there are many ways to lower the risk of passing this HIV to your unborn baby, and then even to almost zero level, because of course I've been in many hospitals and then they have given their children as zero, as in they are negative. Okay, so taking treatment properly can reduce the risk of your baby being born with HIV to less than 1%. So if you knew that you were HIV positive before you got pregnant, you may be taking treatment already. So if you are not, then talk to a healthcare professional about starting treatment as soon as possible, because guys, it's not funny when your baby happens to become positive, because if you follow me on this channel, you're going to see the reason why I said it's not funny. Okay, it's not funny. So if you found out that living with HIV during your pregnancy, and then it is recommended that you start treatment as soon as possible and continue taking it every day for life. All right, so your baby will also be given treatment for 4 to 6 weeks after they are born to help prevent an HIV infection developing. Okay, anyways guys, so I'm gonna be wrapping up here, and I believe that you have really learned today. I'd kindly say that we should join hands together to fight HIV and AIDS in our world. However, I'll be bringing back to your way, so this time next week, further things for you to learn from. And guys, kindly stay tuned on this channel. So if you like my video, kindly give me a thumbs up, and then if you can also subscribe to my YouTube channel and as well hit the notification bell, so that you'll be the first person, like I said, to get notified when the next version of the video is being released. You can as well share this link to your friends and family so that they can get to know what is going on in the HIV world, and also to protect people around you, and also prevent people around you from being infected as well. So thank you guys, thank you for listening, and see you in my next video. Bye.